it's me, Dr. Jane D. Ray. I told you we're going to be learning about infections today, most especially urinary tract infection. You are in the right place. Now, urinary tract infection has been confused for many other things. He said, I have stuff. I'm wondering which kind of stuff. Is it the people working for you? Is it the ones in your office? Or is this staphylococcus, the one that is on the skin and everywhere? Most times what we're confused for staphylococcus is not. The urinary tract comprises of the kidney, the ureter, the bladder, the urethra. Therefore, so if you are having symptoms in the kidney, it will be different from when you are having symptoms of the urethra or when you are having symptoms of the bladder. For somebody that is having issues with the kidney, might present with loin pain. There's somebody that is having issues with the bladder, might not present first with loin pain. So, and we've noticed that these urinary tract infections can happen to both male and female, but they are commoner amongst the female folks just because of two facts. The first, because of the anatomy of the female body. Yes. Remember, the woman has 3 openings down there. You have the urethra. I know many ladies don't even know where the urethra is. You have the urethra. That is from where you urinate from, where you pee from. You don't urinate from the vagina. The urethra is just a little opening just beneath the clitoris. Now, you don't have the vagina and you have the anus. Now, for the male folks, there are just 2 openings. And the urethra for the male opens on the penis. So it's a little away from the anus. So they have a reduced risk of feces, that is excreta, moving and touching the tip of the penis. But for the woman at times, they clean from back forward, which is wrong. And so the person can move infections and infect the urethra. Now, this is also very common in children. That is why most children present with urinary tract infection. And that's why I tell parents that every fever in a child is not malaria, it's not typhoid. You need to know that. So, when you are cleaning a child, let's say the child passes excreta and you are wiping the diaper, and most times parents are not very careful or caregivers are not very careful, they can mistakenly push the excreta into the little opening that is the urethra. And that means once the poo enters, it can infect the child, and the child comes down with urinary tract infections, with fever. So another reason too why it's common in females is because our urethra is short compared to how long that of a male is. So females, or those that were assigned female at birth, the AFABs. You know, some people say they are not females, but they were assigned female at birth. So they are also prone to this other risk. So now, when this happens, what are the symptoms the person will have? The person can have symptoms ranging from flank pain to lower abdominal pain. Yes, just lower abdomen, so probably just beneath the navel, the person might be having pain there. The person might also have another symptom of urinary incontinence. That is, most times, because of the irritation of the bladder that is affected. You don't notice that you have the urge to urinate. But because there is an infection ongoing, before you reach the restroom, the urine is already coming out. Or before you are ready to urinate, you're already wetting yourself. The person can also come down with pain urinating, dysuria. Yes, symptoms of pain. So if it's a child who asks, does this child cry when the child is urinating? That might be a symptom you need to look out for. Yes, the person might also come down with passage of foul smelling or colored or cloudy urine. Yes, foul smelling. So if you notice that your urine is smelling more than it should, you might need to check out for urinary tract infection. There are also some other symptoms like fever. Yes, the person might have fever, the person might have chills. So, and these symptoms is not just for you to now say, okay, I have it then, now I know. What else can I do? What else can you do? When you now know, it is time to, you may need to investigate, you may need to go to a lab and test properly. You may need to get to a doctor so that doctor will prescribe for you. Another way it is gotten is also Yes, I know you may not like this one, but it's also when people finger themselves and the person is using a dirty finger and the person is touching the meatus. Or in men too, maybe you're masturbating and dating and touching the meatus. You can actually move microorganisms that were just on the skin or outside and move them there. Yes, very important. And another way too is when people actually don't clean well. I've already mentioned it, when you are cleaning from back forward. From back forward. So you want to clean after using the toilet, we advise you clean from front backwards, not from back forward. So this might be the way the person can get it. So when it's gotten, please treat adequately. Treat adequately. I don't prescribe drugs on live videos, but you can contact us or meet any doctor that will prescribe for you. You treat adequately. But most importantly, I also want to talk about some of the ways to prevent it. I've already spoken about the way to clean yourself, hygiene practices. Another way to we get is that ladies too, you might actually consider urinating immediately after sex. Yes. When you urinate immediately after sex, the urine actually flushes that place. In case there was something that entered where it's not supposed to enter, the urine will do a lot of flushing work for you. So you can as well try and urinate after sex. Another way is take a lot of fluids. A lot of fluids will help increase the frequency of times you urinate. And remember, when there is stasis, there is bound to be more infection. What do I mean by stasis? Have you ever urinated in a container, you covered it, and you opened it the next morning? You know, it has stayed there. There is stasis already. You now notice that the microorganisms are already acting on it. So when you're also not taking enough fluid in your system, you are increasing the transit time or increasing the time that urine stays in your body. And when there is stasis, infections can grow. But when you're taking enough fluid, you now notice that you are emptying very well and you're not giving room to infection. Do you understand? Another way to we tell ladies is you also know where you want to open yourself up to when you want to urinate. Yes, you may not open yourself in a public toilet or a public place where when you urinate, urine will splash back on you. That splash back is that has stayed for a while. That splashing back is a dirty water. That splash back is something that you don't know what is it. And definitely there will be microorganisms there which will now come and enter your body. So you may notice you can get it from there. So you may need to be careful when you open yourself to, where you squat, where you want to use. Okay, I hope this is helpful. Let's look out for some of these symptoms whenever they show up and treat it adequately so that urinary tract infection will not be staying with us. I hope you learned something. I'll see you in my next video. Bye.